这个微信翻译不太准确啊。第一个，第二个，有些部分呢，因为有版权的这些神经心理测验，不可以做视频，所以这些部分就没有啊。大家担待。
one. We have okay. Then I can do. We do need break. Then I can finish earlier. Can? Yeah. Then you can go for your lunch. This is very important. So why? Because it's very important because here p value is 0.03. But I will tell you something important. P value less than 0.05 may not mean anything because you need to consider the so-called clinically important difference. It's like this group of people, 0.1 cm higher than this group of people. It doesn't matter, not really matter, right? But it's 1 cm, 10 cm. So what matter to you? Yeah. How to say? It's like your blood pressure. If the drug can reduce 1 mmHg, is it effective? You can show that, but is it clinically important? May not be, right? I want to lose weight, right? I lose 1 gram a day. Is it important? May not be, right? So that's why for this, the primary outcome is ADAS-COG. What happened? This group from Oxford, they recruit a group of dementia, and then they allocate 2 to 1 aerobic and strength exercise 4 months, and then the control just as usual, meaning no extra intervention. Other than the higher the score, the poorer cognition. Meaning the exercise group is have a poorer cognition than the control group. The reverse, right? The opposite from what the scientists expect. But the clinical significance is 2.45. So this difference is not important because minus 1.4. Get me? Yeah. So statistically significant may not be clinically significant. So always look at what's the clinically important difference for so-called efficacy. When you have enough sample size, you can show small p-value less than 0.005 for small difference, right? But what really matter for the patient, yeah, is important. So if you believe this one, okay, exercise is not really working, right? Exercise may have other benefit. Yeah, you need to engage the patient, especially in the in a nursing home setting. The patient is very bored, nothing to do. Even you give a small activity like play ukulele or listen to music or do a little bit of gardening will be helpful. So that's the point. Yeah. And there are other symptoms, psychosis, agitation, depression, so on. But we do not recommend pharmaceutical intervention for those symptoms because that may do harm rather than give the benefit. So in this setting, you need to weigh the benefit versus the potential harm. So at least no harm, right? So that's why non-pharmaceutical approach better than just prescribe. Okay, depression. If you have depression, we are not recommending antidepressant unless you really need to do that. So that's why we talk about dementia, but dementia also have a different stage, right? So at the mild stage, we try to slow the progression, improve the function, and then because at this stage the patient still have a certain level of function, better also plan the finance. You have big money, how I'm going to deal with that big money, right? And then if you are the patient still have certain function, how about if you do something you want to do before you get really dependent, right? So that's the time window. Then moderate, severe is more maximization of comfort, so increase the quality of life rather than rather than do something not necessary. After death, bereavement, of course. Yeah. So that's a different model. We cannot cure, so we need to prevent, right? So that's why now we are talking about prevention. Before that, I do a little bit more. Who want to try more test? Who want to? Maybe I don't score it. But just to give you a sense of. You want to try? Bring the what? Oh, you want to try? Yeah. So, okay, this is corporal design. This is one of the IQ subtests in Wechsler. Okay, you see, Wechsler standard corporal design test. Yeah, you did IQ before. That's your IQ test. Particle. Visual. Let's see. You see there are some blocks, right? They're all the same. Some sides are red, and some are white. Half red. So I will make the design based on this. Brenda use yesterday. So, right? See it, right? Can you make this one? Yeah. Okay, good. Basically, we will record the time also. So now I need to track now to the time. How long is the one? No, if when she cannot make it, you can try. You can try. Yeah. She cannot make it, you continue. See whether you can. You can come, yeah. So, okay. How about this one? For the text in the real texting is time limit. Yeah. So after certain time it will stop. Today is more for demonstration. So I will let you try until I feel something will help you. Huh? Okay, good. How about more? Okay, how about this one? So for this, we give 120 seconds. 120 seconds. Can you become the next one you start timing? Once this one already okay, you go ahead. 完标人的习有该什么？Master, 2 minutes people up to me. Then okay, 好了。Okay, good. That is right. Okay, you are very good and you are special. This one, right? Okay. Okay. I do. So this test will also go 68. Yeah. If you make this, you'll get also. Huh? 40, 140. Oh, you almost get for, yeah. Because if you're within 35, then you get 75. You can see your blog design, raw score 67. You can see almost the score. Try. You want to try? Want to play? Yeah. Try. Yeah. Yeah. Try. Yeah. See how fast you can do it. You time yourself. Yeah. Everyone can try. Yeah. So I'm going to talk, then you will try. Yeah. See how fast you can. Yeah. Within 2 minutes up. So now we are talking about the prevention. So because we know there are modifiable factors, there are multiple factors modifiable. So you can try to reduce the brain inflammation and then try to increase the reserve. The more reserve you have, it's like the government, right? During the COVID, government spend the reserve. You have reserve, so you can use the reserve. The more reserve you have, the more you use your brain. It's like exercise, right? You get bigger muscle, then you can afford to lose speed with a bit. You're still stronger than others, and then reduce the brain damage, vascular damage, due to toxic or stress. And then based on the consensus, there are 14 modifiable risk factors. This is not really modifiable because you already complete education, right? So more education, lower chance of getting dementia. That's for sure. More education. Yeah. You use more reserve. It's more value reserve. So as a midlife, hearing loss is a risk factor. High cholesterol, depression, traumatic brain injury, physical inactivity, diabetes, smoking, hypertension, obesity, and exercise, etc. and alcohol. So if